job.
Okay, better. All right. Thank you. All right. So first thing I want to do, I want to make sure that all of my instruments are clean. Okay. So you may have been using your instruments and they have wax on them and stuff. So first thing I'm going to do is make sure that my instruments are good and clean. All right. So I got a Bunsen burner and I'm going to take the time to make sure that all of my instruments are clean and they don't have excess wax or stone or plaster or whatever gunk on there. And make sure that your instruments are good and clean. If they have like a lot of carbon residue on there, it will transfer to your wax up. All right? Now, my thinking is that you have your nice wax up and everything is as it should be. I'd like you to make sure that on your wax up that you have a midline marked. You should have a midline marked on your upper on your upper rim, as well as the midline on your lower rim. Okay, so make sure you have that. Make sure that your midline is on your wax. Now, I think I encouraged everybody to get their syllabus in front of them. And if you have your syllabus in front of you, on the page that it talks about the arrangement of artificial teeth, let's pay attention to the chart, okay? And on the chart, at the upper right, the upper left, you'll see there's a place where it talks about the upper central incisor. Upper central incisor. So they're talking about the upper central incisor. And how many central incisors are there? How many upper central incisors are there? 2, right? So when you're talking about the upper central incisor, they're actually talking about both right and left central incisors. And you'll see that in the chart that we go down to the next category, it'll say upper lateral incisor. Well, they're talking about both of them, number 7 and 10. And it talks about the upper canine. The next one is the upper canine. You have 2 canines, the right and the left canine, on the upper arch. It also shows the arrangement of artificial teeth for the lower central incisors. Okay, so you have 2 lower central incisors. And you have 2 lateral incisors. And you have 2 lower canines. All right, so those are the teeth that we're going to be dealing with today. We'll talk about the other teeth maybe at our next visit. I think we'll only get to maybe a few teeth today, maybe not many at all, but look at the chart and look at the labial lingual inclination of the upper central incisor. Okay? The labial lingual inclination of the upper central incisor. And look at the labial lingual inclination for the upper lateral incisor. And it says something completely different. Okay? And we'll make these things clear when we go on our journey. And if you look at the upper canine, look at the labial lingual inclination, and I want you to underline where it says out at the neck. Out at the neck. And you need to understand what that means, and I'll help you to do that as we go along this journey. All right, so look at the labiolingual inclination of the upper canine, and it says out at the neck. Underline that. Where it says out at the neck for the upper canine. Okay, so what do they mean when they're talking about the labiolingual inclination? All right, so if you look at there's on the bottom of that page, there is a title that says Basic Placement of Anterior Teeth. There are 5 important factors involved in positioning anterior teeth. And number 1 is the anterior slope. So we saw on the program this morning where Dr. Goodacre was orienting the teeth, and he was doing it digitally, and he had the plane of occlusion such that he could move it around. Before you do it digitally, you got to kind of understand some of these parameters. Okay, you have to understand these factors that are involved with positioning, particularly these anterior teeth, because that's where we start. And as we look at up at the top at the upper central incisor, and it's got the other box that says labiolingual inclination, it says that is parallel to the profile line of the face, which is usually perpendicular. Okay. So number 1 is anterior slope. That's our labial inclination. So you got to understand that these things are arranged in a kind of there are a lot of little factors that involve the placement of the teeth. So it's not we just put it in and there it is. All right. These teeth don't have roots on them. These artificial teeth, like these upper artificial teeth, they don't have roots on them. But in your mind's eye, you should be able to imagine that they have a root on them. All right. All right, let's go down to the basic placement where it says mesial distal inclination. So that means when we look at the chart, we're going to figure out when we look at the upper central incisor, what is its mesial distal inclination? That means how does it move? How can we make it, how can we set the tooth so that it looks the way we want it to look? Do we need to make it a more perpendicular mesial distal inclination, or do we need to make it a little distal, more mesial? A lot of times people set the teeth and the mesial distal inclination is not perpendicular, but the line is a little bit to the mesial. What do I mean? All right, now I'm going to draw a picture right quick. I want you to pay attention to the fact that this will be our plane of occlusion. All right, and if this is the midline on our plane of occlusion, if we're going to place a tooth, a maxillary central incisor, and it says that the mesial distal inclination is perpendicular, that means since we know about this tooth, we know that anatomically it has a root that travels, the root attaches to the mesial portion of that tooth at that curvature about 1 millimeter lower than on the mesial than it does on the distal. So it attaches here, and it attaches here, and guess what? These run parallel for a while, but they end a little bit distal with a blunt apex. So that's pretty much what that central incisor does, right? And in our mind's eye, we can kind of see that this, thus, incisal edge and the occlusal plane are together, and this tooth is perpendicular to the long axis, even though the apex is slightly to the distal. All right, so let's do the same thing for the other central over here. We'll do the same mirror sort of thing and understand. I just want you to understand these centrals before we get started, because what I see a lot of times is that we lose track of where that collar is. All right, so like we don't really have an apex or a root on these teeth, but I want you to pay attention to, though, even though it is perpendicular, that the neck of this tooth is slightly angled to the distal, right? In the natural sense. What I have seen in the past, I've seen the student to set the teeth up, and this is the midline, and they set the central like this, as if it had a root going that way. And they might set the other central like this, but you can't see the root, so you don't know. But you know doing that. But the root would be going like this. Don't do that, right? When we're setting these teeth up, be cognizant of these parameters that we're talking about in the arrangement of artificial teeth. All right. Another thing that you saw on the video that Dr. Goodacre talked about was the rotational situation. So let's go back to down at the bottom where it talks about placement of anterior teeth. Anterior slope, mesial distal inclination, inferior, superior positioning on a horizontal plane. So that's pretty simple. You're going to find that we talk about the relationship on the plane, which is this, and if you're not careful, you'll lose your plane. But we want those central incisors to be on the plane. Remember, Dr. Goodacre had it so it rotated, and but that's the occlusal plane. He even rotated it so that we could look at it from the occlusal view. So he even rotated it such that we looked at it from an occlusal view. All right, so that's the frontal view. This is the frontal view. And we talk about the mesial distal inclination, but then we talk about, when we look at it from the occlusal view or incisal view, we go down to number 4 where it says rotation on a long axis. And if we look at our chart at the top where it says rotational, it says it's parallel with the curve of the arch. All right, now let me run some things to you that I've told you before when we were making these things that were important. One of the things that I told you that was really important was to make sure that we had this properly contoured, the facial portion, which we're going to call the curve of the arch. All right, this is the curve of the arch. We also remember that when we were making this, that we had a little bit of a labial inclination, okay, on the anterior part. Remember when we talked about where those teeth were going to be? So these are important features that will help you when you start setting these teeth. So let me just say this. The easier setup is the one that has good rims. So because the teeth just kind of go into place if the rims are right. So if your rim is right, then it makes it kind of easy. So when it talks about inferior or superior positioning on the horizontal plane, we're going to find that that central incisor is going to be on the plane. All right. So back to my drawing, we see that the central incisors are on the plane, but the lateral incisors, where it talks about the lateral incisors, the relationship is above the plane. So we're going to say that when we have that lateral incisor to be set, that it's not going to be on the same level as that central incisor. It's going to be slightly off the plane. All right, so we've got the centrals on the plane, and we've got the laterals that are slightly above the plane. Oh, I say about, let's say about 5 tenths of a millimeter, right? About a half a millimeter, right? Above the plane. And we also know that this tooth also has the root. If we look at the labial inclination, or the mesial-distal inclination, we're going to be slightly, if it had a root, it doesn't have a root, but if it had a root, it would be going slightly to the distal, slightly to the distal, right? Remember, it's goes to the distal, but then it kind of comes back like that. Really, that lateral is kind of it's not a small central, it's really a tooth of its own, right? But even though it has that mesial little hook there, it still has a slight distal inclination, all right, on that maxillary lateral incisor. Now, for the canine, this is the big deal. And, well, we're looking at it from the frontal view, but also if we looked at it from the occlusal view, we'd see that when we look at the lateral, we looked at it from the occlusal view. Well, everybody kind of wants to be in line with everybody else. So we're going to have the centrals, the incisal ridge of the centrals are going to be in concert with each other, but the lateral incisor, the mesial portion of the lateral incisor is going to be in concert with the distal portion of the central, but the distal portion of the lateral incisor is going to be in concert with the mesial portion of the canine. All right, so it's important that you understand all these, not just anatomic landmarks, but tooth anatomy. All right, so that we can, make these things the way they're supposed to be. So look at, for the upper lateral incisor, it says that when you place it, the labiolingual inclination is to the lingual at the neck, so he's kind of depressed, to the distal at the neck, so it's slightly to the distal. But when we talk about rotational, when we look at it from the occlusal view, and where it says rotational, why don't you put up above rotational, right, incisal dash occlusal, so that you'll kind of understand that that's the view. When we talk about rotational, that's the view that we're looking at. Excuse me, so we see that lateral incisor, the distal half, is rotated to the lingual, or the mesial toward the labial, and it's above the plane. All right, let's go to the canine. From perpendicular to what? Out at the neck. It's got to be out at the neck. So it's a little bit to the distal, out at the neck. When you look at the mesial distal inclination, very slightly to the distal at the neck. On the rotation, the distal half of the labial surface is pointing in the direction of the posterior arch. And what does that mean? Well, I think if we turn the page, maybe we'll see that one. Let's see. It doesn't show that. It doesn't. But I'll show it to you. I will show you. All right, so in this drawing, if we look at this situation, We're looking at it from an occlusal view. We'd see that we have our central incisors. So this represents the incisal edge of the maxillary central incisors. That'll be the facial surface of those central incisors. And this is the lingual surface. Pretty much. You know anatomy as good as I do. Now, with the lateral, this is the incisal edge. The lateral incisor is in concert with the central incisors, but it twists a little bit on the distal. So that way, when we look at this tooth, you know, a lot of times people don't realize that it is as wide a tooth as it actually is. That tooth actually is wider than it appears. But since it's twisted on its axis, it looks like it's a skinnier tooth. So my eyeball, when I look at this tooth, I don't see this distal portion of the tooth, I just see this, so it looks like it's narrower. All right, so that's the laterals. So that incisal edge is in concert with the centrals, but it got a little twist on there. So you got the lateral incisor, and it twists on its axis. Now, for the canine, very important, the mesial ridge of the canine is in concert with the incisal edge of that lateral. But remember, we said out at the neck, so let's go up here and show out at the neck. Actually, that canine is out at the neck, and it kind of tucks in. That's what I mean by out at the neck. This area here is out, so we got that, and if we had a root on there, that root would be going in like this. It's the same height, a little bit taller than that canine. Than the central. And it also is on the table. But from this view, from that rotational view, we see that mesial ridge. Now we've got the distal ridge, and the distal ridge should point to the rest of the arch. So the rest of the arch, the rest of the facial ridges of these posterior teeth should follow that distal ridge of the canine. All right, so when we look at it from this view, we got the mesial ridge, the distal ridge, canine going, big old canine. And that distal ridge should be pointing to the rest of the arch. So the rest of your facial ridges should be sort of in concert with that distal ridge of the canine. All right, so let's get started. So the first thing I want to do is I want to make some room for my upper central incisor. Now I've got my upper central incisor here. I can see the shape of it. I can see the size of it. So what I'm going to do is I'm going to take my knife and I'm going to remove wax so that I can place that central incisor in there. So let's see how that works out. So let's see how that works. Well, I got a midline, and on that midline, see my midline? See it? I'm going to remove wax right about the width of my central incisor. So I cut a little place out of my wax, and I remove the wax so that I've got like a little place where my tooth is going to go according to my chart. All right, so you can see that I've removed wax for my tooth number 9. All right, so wax is out of the way. You can see it from the side of the view. I've removed wax. And now I'm going to take my tooth and I'm going to take my number 31 spatula. I'm going to make sure that wax is molten, and I'm going to place that tooth. So take my number 31 spatula, get it hot, and now I'm going to place that tooth right in there. Okay. Now, I'm going to use this plane to make sure that the incisal edge is on the plane. That's where that comes in. That's very helpful. All right. Not only is the incisal edge on the plane, but the tooth itself is parallel with the shape of the arch. So I've got that tooth set, all right? And since it's set, I'm gonna come back and put some hot wax around it so that it doesn't move around while I place my second tooth, which is gonna be my tooth number 8. All right, so I'm putting tooth number 9 in here, and I'm putting it in such that it is straight, but I know that the neck in reality kind of goes a little bit to the distal. And I'm actually going to cover my neck with a little wax. So I'll cover the neck with a little bit of wax. Because on these teeth, they're kind of engineered so that there's a neck. So I'm covering the neck with the wax. I mean, what could be more simple? You can do this with me. All right, so I've got my tooth number 9 set, and I'm going to solidify it lingually with a little heat. So I put a little heat to it so that now it won't be moving around when I do my next setup. So have I done everything that we know to do? Well, what do we know to do? We know that it should be parallel to the profile, which it is. We know that the mesial distal inclination is pretty much perpendicular. We look at it from the occlusal view and we see that it is in concert with the curve, and we check with our plane and we see that it is on the plane. So yes, we have done the first tooth. All right, so now let's look at it, and this is how it kind of looks once we've set that first tooth. Okay, so we gotta be mindful of our midline. All right, so now I'm gonna remove some wax for tooth number 8 so I can place in my other central incisors. So we'll have upper central incisors placed. So what do? We take the knife, we remove wax, just about the mesial distal width of that central incisor on the other side. Right? So we're gonna remove the wax. Remove it. Do the best you can. Keep in mind where your midline is. Don't lose your midline. All right, I'm going to remove this wax so that I have a little plug of wax that I'm taking out that's pretty much the size and shape of our central incisor that we're going to place in there. So we've kind of removed a little plug of wax, and that is where we're going to place our next tooth. So it's really true. If you've got good rims, boy, the teeth just go right to place. Now, some of you may be finding that when we do this, that we're getting kind of close to the rim. You can see that there's some portions of the rim kind of showing through. If that's the case, sometimes we need to grind on the rim so that we can have room enough to place the teeth. But I'm going to go ahead on and heat up that area so that I can place my tooth number 8 where the central incisor goes. So here we go. Let's heat it up with number 31. I like the number 31 because it holds more heat than the number 7. So here I go. I'm getting it all hot. Got it hot, and then I'm going to place my tooth number 8. Just hold on a minute. I'll answer once I get it set. I got to concentrate a little bit. All right, so now I've got my central incisors. Okay, talk to me. What's up? No, it's supposed to be on the plane. So check it on the look. Check it on the plane. Yeah, okay, incisor. It just follows the arch. All right.
Oh yes, I know exactly what you're doing. That's my favorite.
Okay. So I'm going to put it back on my articulator, and I'm going to close it down onto my lower ridge, and there we go. And that is my central incisors that are set up. All right, now I'm going to just put a little wax around there so that it's nice and clean and ready to go to the next step. So I'll take my hot instrument, and my hot instrument will solidify these teeth in the wax rim. So they're my on the lingual portion.
I didn't sign up for today because I don't know if Tuesday. They don't have a class that works for Tuesday. Where are you going?
And then on the facial, I'm going to add a little wax around the neck, like I did on the neck, like I did on tooth number 9. So I'll be adding a little wax around the cervical of 8 and 9. Add a little bit around. I did 8. No, I did 9. Add a little bit around 8. I got 8 and 9 set. So these teeth are set. 8 and 9.
So that means is pretty. I'm gonna find it.
Now I'm gonna bring to your attention that excuse me, This week is a special week in the hair industry. This is, we call Thursday Turpin Memorial Day. And on Turpin Memorial Day, we have our annual Turpin Memorial Heritage Lecture. And that's the day that we honor Dr. Donald Turpin. Dr. Turpin was the dean of the dental school back in the, 20s or 30s or so. And we honor him because if it wasn't for him and sacrifices he and his wife made, they kept the school going financially. And if it wasn't for Dr. Turpin, we may have folded financially in the early years of our existence here at Meharry. So we honor Dr. Turpin, who died on a Good Friday. So we acknowledge Dr. Turpin, and we use that day as one of our heritage lectures. And I don't know if you missed it last year or not. If you missed it last year, you missed a treat. Dr. Damian Fisher from Atlanta, Georgia, gave a phenomenal lecture. He was a student of mine, or a student here at Meharry back in the old days. He's a very successful orthodontist and gave a phenomenal presentation. Now, we used to have it so it was live, but the campus hasn't opened up yet for us to have live presentations. But Dr. Fisher did a phenomenal job, and Turpin lectures usually, I feel, one of the better lectures that we have all year. This year, it was my pleasure to invite Dr. Samuel Johnson. Dr. Johnson is a dentist in Mobile, Alabama. And by the way, I'm cutting a window now for my lateral inside. Dr. Johnson is a general dentist in Mobile, Alabama, but Dr. Johnson is an aesthetic dentist, and he has written articles. He has appeared in many scientific journals. I recognized that when Dr. Johnson was in school that, you just recognize talent as as you go. And he's a very talented student, and he's a general dentist, but there's not many prosthodontists that could really compete with him in terms of his aesthetic view on restoration. So he has a lecture for us this Thursday, Turpin Memorial Day. Now, Turpin Memorial Day is also the day that we acknowledge the people who have shown themselves to be exemplary. It's sponsored by Omicron Kappa Upsilon, which is the National Dental Honor Society. So you see I cut a window for my lateral, and then I'm going to place my lateral. I'm going to heat it up and place my lateral, but I'm going to tell you this story about Omicron Kappa Upsilon, because I don't know if y'all are going to be in attendance, but since you need to be to hear Dr. Johnson and see some of the stuff that he's doing, But y'all have heard of G.B. Black? Y'all know about G.B. Black?
Yes.
What do they say about him? Yeah, I never knew other than he was the father of modern dentistry. That's what they always say, right? Well, come to find out, Dr. Black, a lot of stuff starts in Chicago for some reason, but Northwestern University Dental School, I can remember when I grew up in Chicago, and there were three dental schools in the city of Chicago. There was Northwestern University Dental School, and that was in Chicago. The undergraduate campus of Northwestern is in Evanston, but the undergraduate campus is in Chicago. There was Northwestern, there was Loyola, and University of Illinois. Right, so three dental schools in Chicago. So Chicago was evidently a place where dentistry was a prevailing kind of a craft. It was, before dental schools, it was kind of a brutal kind of a thing where you go to the barber and he'd tell you to put your foot in his chest and he'd take out a tooth. Or they had a black dentist called Black Bart who would ride on his horse, and if you were black and you had a tooth that needed pulling, he'd stay on his horse and you just go up to his horse. With his pullings, he'd pull your tooth. So it was kind of barbaric, you know, in the early years of dentistry in the United States. One of the earlier dentists was Paul Revere, you know, because he was a silversmith and he was able to craft teeth out of silver. Now you notice on the lateral that I'm about 1 millimeter above the plane, slightly above the plane. All right, so my centrals are on the plane, but my lateral is slightly above the plane. All right. So on June 26, 1913, listen to me now. A resolution regarding the establishment of a National Dental Honor Society was presented by these students at Northwestern. They presented this idea to Dr. Black, Dr. G.V. Black. He was the dean of Northwestern's dental school at that time. And he was impressed with this resolution. He was so impressed that he formed a committee, and he drew a letter and sent it to the deans of 51 dental schools across the nation. Okay, so what am I talking about? I'm talking about these students who were good students. They wanted to have a National Dental Honor Society. They presented this to Dr. Black. Dr. Black I'm talking, listen to me. All right. Dr. Black, this is really important that you know who you are. You got to know who you are, and I'm about to tell you who you are. Really. You don't really know who you are. Listen to me now. So that was 1913, right? So Meharry was in existence, but you know, it was a small school for sons and daughters of former slaves. So we weren't even sent an invitation to have a chapter of OKU at Meharry. We weren't even considered. They sent these invitations to the deans of 51 dental schools across the nation. And the initial response was well received, but many of the deans thought that it should be recognized by having a proper name and a Greek letter insignia. That was, I guess, at that time, that was what was in vogue, to have an organization that was a scholarly organization, was defined by having a Greek name, right? So they came up with the name and the ideals of modern dentistry. So at the time, dentistry was kind of barbaric. So the idea was that you want to have conservation of teeth and health. The conservation of teeth and health. That's kind of a new concept. That was a new concept at that time, right? To conserve teeth and have health. Usually they would just extract the teeth. But we got dental schools now, and we want to conserve teeth. So, so they came up with a name, and the name was Omicron Kappa Upsilon. And the Greek letters, Odus, if you look at the key, there's a key that represents this organization, and you've got an O and a K and a U. The O stands for teeth. Upsilon stands for hygia, or health. Kappa is the first letter in the word chi, which stands for and, thus, teeth and health. Omicron Kappa Upsilon. And they made this statement. They said that Omicron Kappa Upsilon has always striven to encourage and develop a spirit of emulation among students in dentistry. And they recognize in an appropriate manner those who have distinguished themselves by maintaining a high level of scholarship. So that was the statement, and that was the beginning of Omicron Kappa Upsilon, the National Dental Honor Society. Well, you know, we're a little small school in Nashville, and in 1945, the dean and clinical director's name was Dr. Clifton O. Dummett. Now, let's keep in mind who Dr. Dummett was. Dr. Dummett was this brother that went to Northwestern University Dental School. And he was so brilliant. He was the head and shoulders above every other dental student that had come to Northwestern University, except maybe G.B. Black himself. They all knew that Dr. Dummett was a scholar. And here he is, young man, the dean of Meharry Medical College School of Dentistry in Nashville, Tennessee. So now Dr. Dummett was impressed with the clinical and the competitive performances of his students. So he saw his students and he's like, hey, there's some talented young dentists gonna be here, right? So he was impressed with the clinical and the competitive nature of his students here at Meharry, and he thought that they were worthy of consideration for national recognition. Like, hey, we should have OKU here at Meharry. So he sent in a petition to OKU in Chicago, and they sent him back an application, and he went on and filled out the application. He complied with the instructions, but they never answered him back. This is in 1945. 1944. Hey, he just didn't answer. What? How he make his mouth to even want to be included in this prestigious organization? That seemed to be the mindset. I don't know. But let's just keep it clean and say he never received any word from OKU. Never received a word. Then he was in attendance, Dr. Dummett was in attendance at the National Dental School meeting, which was held in Chicago. And that's when he found out the true meaning behind what they now call the OKU incident. Okay? So somebody let him know that, hey, we didn't vote on you all because, you know, your students are Negroes. That's why. Let's tell it. But now let's remember that Dr. Dummett wasn't, they knew Dr. Dummett was a bad dude. All right? So all of the people that were associated with Omicron Kappa Epsilon were former teachers of Dr. Dummett. And so this guy, Dr. Robert E. Blackwell, he addressed the body of OKU in an honest and forthright manner, and it's evidenced in an excerpt from a book that Dr. Dummett himself wrote. And what he said, to just kind of give a snippet of it, and this guy, Dr. Blackwell, is talking to the body of Omicron Kappa Epsilon, and he said that it should not be necessary for me to remind you that gentlemanly conduct, genius, industry are not confined to the white race. Why a school should be denied a charter in our esteemed organization simply because its students are Negroes is beyond my comprehension. Then he goes on to say that, and you gotta remember at this time, what was going on in the world, World War II was going on. And we over here in Germany and fighting, Hitler, and trying to keep some semblance of democracy alive. And so he says, and finally, when we are trying to keep some semblance of democracy alive, that we as Omicron Kappa Epsilon should be trying to further that effort. And so Dr. Dummett returned to Nashville, and he resubmitted his petition, and shortly after that, he was awarded, or we were awarded here at Meharry, Omicron Kappa Upsilon, which was the first time in history that a school for African Americans was recognized by a National Honor Society. It'll be another 12 years before the School of Medicine would be recognized by Alpha Omega Alpha, the National Medical Honor Society. So you gotta know who you are, right? And what a phenomenal, what a phenomenal history we have. All right, so let's take this all the way full circle. So on Thursday, we recognized the students who have been selected to be in Omicron Kappa Upsilon as alumni members. Dr. James Brown felt some years ago that it would be a nice gesture. The national chapter suggested that different chapters come up with ideas that would increase the awareness of Omicron Kappa Upsilon on their campuses. And Dr. Brown came up, he was a Armenian, he came up with a recognition where students would be recognized during their matriculation in dental school with a We Are Watching You program. So we've come up with this We Are Watching You program where we kind of pay attention to students who have shown to be of high character and have performed well in their clinical and classroom activities with different letters. So we came up with that we're going to use an O letter for the freshman people, a K letter for the sophomore people, and a U letter for the junior people. So it doesn't mean that you're going to be selected in the OKU, which is a thing that I didn't like, because some people they get an O letter, they get a K letter, and then they don't get in because they didn't get voted in by the people who were voting. And I just think that's horrible. But the rules are such that we can only take so many per class. So I don't like it for that reason, because there are some of you who just, it's hard to distinguish who's better than whom, especially when you all are seeing patients and doing well in the clinic and doing what you got to do. So anyway, that's what's going to happen on Thursday. We have a lecture with Dr. Samuel Johnson from Mobile, and we're going to recognize the alumni members from the senior class, and those of you who, I think some of you were recognized last year with an O letter. This year, we recognize the people in your class with a K letter, and I think Ms. Chumley, if she hasn't already let you know who you are, we'll be letting you know who you are. But I want you to really be at the lecture. Now, let me show you something here on these teeth. So I've got these teeth set up. I've got the central and the laterals set up, right? And so what I'd like to do is I'd like to show you how to use your carver, your Lacron carver, or your number 6 carver, or a maybe even a number 7 spatula. But I'm going to show you how to carve the wax around these teeth. So like right now, all I've done is maxillary central and maxillary laterals. But now watch what happens here. I'm going to, let me put a little bit more. All right, I'm going to show you how to use your instruments to make it look nice. So one of the things that I'd like you to have, you may not have it, but if you have your hand-out torch, if you have your torch, and you got a torch, so I have a hand-out torch, and the torch, If I like, there we go. If your torch works properly, you should be able to, when you, I don't know if you can see it or not, can you see the little torch? Can you see the flame? Yeah, see it? That's what you need to have. And so, if you twist this part of the torch head, that'll tighten it up so that you don't have any air coming through there. If you have it open, it won't do it as much. It'll be a fatter flame. So now if we tighten it up, it'll be a real keen flame. Okay, so I'm going to use that keen flame and just lightly torch the anterior wax. All right, so I'm just going to lightly torch that. Now, pay attention to what I do with my carving instruments. This is a carver. All right, this is, I think, a number 6 carver. I don't know what yours says. But I like this carver for this. You could use this carver, or you could use a Lacron carver. You could use a 7-on knife. You could use a number 7 wax spatula. But I'm going to use this, and what I'm going to show you is that I'm going to remove the wax around the teeth. There's 2 ways I'm going to do it. One is from the tooth side, and one is from the tissue side. So this is the tooth approach, and then this is the tissue approach. Just pay attention. I know that I may be unclear, but watch what I do. I'm going to actually take this carving instrument and remove the wax from around the tooth. And I'm approaching that tooth from the tooth side. So I'm coming from the tooth, and I make it such that there's no wax on the facial surfaces of this lateral incisor. Right? I'm going to do the same thing for the central incisor. I'm going to take my instrument and go around the neck of the tooth. I'm approaching it from the tooth side, around the neck of the tooth, and I'm actually removing wax off of the tooth. Right? And I'm going to take the instrument, and I'm going to do the same thing for tooth number 8. Removing the wax. It's a nice little scallop around the tooth. And I make sure that I clean all of the wax off of the facial surface of the tooth. Okay. Then I'm going to go around to the lateral and make sure that I take all of that wax off of that facial surface of that lateral incisor. And I approach this from the tooth side. Now, after you've done that, you'll see that there's some flash around the teeth. Well, now I'm going to go from the tissue side and actually put in like a little bevel so that it kind of looks like the gingiva, as if this tooth is emerging from gingiva. So it's like a little bit of a bevel, and you go around each tooth so that you make a nice, clean area where the tooth emerges from the gums, and it doesn't look like what it is. What is it? It's a denture, but we don't want it to look like a denture. We want it to look like natural teeth. So we want the papilla to be as natural looking as they can look. And so this move that I'm making, first from the tooth side and then from the tissue side, enables the anatomy to kind of look like a real tooth. Right? So I'm gonna do that for these centrals. And then I have it for my lateral. And then I'm gonna continue our journey and place in my maxillary canine. All right, so right now, if you're with me, good. All right, so you got the central, lateral, and let's see, I've already told you that I need you to be present at the Turpin lecture. It's a Zoom kind of thing, but man, I'm telling you, Dr. Johnson, I don't know if you made it last year to Dr. Fisher's presentation, but it was phenomenal. And hopefully, okay, I'll tell you a brief piece that I'm involved with. I'm trying to go to the American Academy of Implant Dentistry is having their annual meeting in New Orleans the last weekend of this month. So I'm trying to get it so that I can go to that. And if I go to that, there's some people that have contacted me that would like to come here to talk about some of the things that we're doing in implant dentistry. So let's keep the ball moving. Right. So now I've got central, maxillary central, maxillary lateral. Now for the canine. And remember what I said about the canine. I want it to be out at the neck. All right, so perhaps before we do the canine, I think I need to go to my mandibular incisors. All right? So can you put me on the overhead? I'd like to go to the overhead so you can see where we are, or where I kind of expect you to be now. It's a beautiful story. And now you can follow along with me. I can't see it, but we won't worry about it. I'm just saying I can't see what I should not be able to see. But we won't worry about it. All right, so here you are with the setup so far. And I'm going to remove my pen. You really don't want to, if you ever take your pen off the table, make sure that you put it back on the table. And I'd like you to see what the evidence of what we've done so far. Let me see that. Is that focus? Where's the focus? Is that focus? A little better? Let me see what it looks like. So, I mean, that's I want you to pay attention to the fact that we're going a little bit distal. The gingiva, the collars, that's kind of where we are right now. All right, so the next thing I'm going to do, we got a little time. I'm going to set up my mandibular centrals. And once I get my mandibular centrals in, then I'm going to put in my canine so you can really understand what I mean when I say out at the neck, okay? All right, I'm coming back home. All right, thank you. All right, so let's find, we got the midline on the lower, so let's go ahead and put our, put that pin back, man. You don't want to lose your vertical. You really don't. That's very important. So, I don't want to institute a bad habit. I think maybe I'd be pulling my pin off the table at my, don't do that. But I just wanted you to see. See. Okay. Okay, so let's do some the lower incisors. You know, these are little skinny little teeth, and so what I'm going to do is I'm going to make the area for my tooth. We know it's a skinny little tooth. You make the room for it, carve out the window for the little incisor. Now, if we look at, okay, if you'll turn the page and look at the picture in the upper left-hand corner, okay? You'll see the mandibular, central, lateral, and canine. You'll see how they should be, and one of the things that you're looking at is how it kind of shouldn't be. All right, so that picture on the right is kind of not good, right? But the one on the left is how I like it to be. So let's remove our wax and that little window for the mandibular incisor. Put a little window for that. You gotta kind of keep your midline together. And now that you've taken out, you see that? I've taken out a little window of wax. And we're gonna put this little skinny mandibular left central incisor. And so I get my instrument hot, and I get my wax hot so that it'll receive that central incisor. Right? And it fits right in there, right? Now I'm going to close this down so I can make sure that I'm kind of in the right place and I can see where I'm going. Can you see that? I've gone inferior to my maxillary. And I'm going to depress it a little bit at the neck because that's what it says to do, right? So when I see look at what it says for the lower central incisor, the labial-lingual inclination, and I have depressed that tooth at the neck. Which is what I'm talking about when I say depressed. I have depressed the central incisor at the neck. So I've kind of pushed it in so that it has a little bit of a flare, okay? And so I'm trying to teach you how to follow this chart, because it says some things, and if you know what it says, then it makes it a little easier for you to do the setup. So I kind of like the way that lateral is in there, so I'm gonna solidify that lateral with some heat. So I'm gonna warm it up and solidify that lateral. I think it may got a little too much maybe a little clean, but we'll see. All right, so we're gonna heat it up and solidify it in the wax. There we go. Now, I haven't lost my midline because my next tooth I'm going to place is going to be my other mandibular central incisor. So I'll take my knife again and cut another little window, get that window so I can place my mandibular right central incisor. So I cut my little window out, make a little room for that, and cut it out. So I have room to place my central incisor. Okay, so that's my little window. Okay. And I'm going to take my instrument, my number 31, since it holds so much heat, and I'm going to place that on my wax, melt the wax so I can place my other mandibular central incisor. So hot, get it really hot. And I'm gonna place my other central. And what does it say about my other central incisor? Well, it says that number one is to the lingual at the neck, and it is perpendicular. So sometimes you have a tendency to kind of lean it. I think, at least I do, so I'm gonna kind of move it so it's not leaning so much to the distal. Move it over bodily. So now I've got these two nice little central incisors. Let me see what that looks like when I close down, because I really want to show at this today's visit, I want to show that we have set up the upper and lower six. And then that way, those who need to catch up can catch up. And next week, we can look at setting our premolars and molars. All right, and what does it say it's supposed to be? It says it's supposed to be what? On the plane. So we're going to make sure that when we set up the lower, that it is also, that they are also, the central incisors are on the plane. Okay. And then look at it also from the occlusal or the incisal view, and we want to make sure that the incisal edges are doing what they're supposed to do. So it's really a nice little story if you can, kind of follow it. I think that's what I want right here. Okay, control sizes. How's that look on my articulation? All right, so those are my centrals. Now I'm gonna seal them in with a hot spatula. All right, so I'm about ready to get going with my mandibular lateral incisors. So that's my central. All right, let's get these laterals in here, and basically, what the width is. What's the width? It's skinny. All right, so skinny it up. Go and get that skinny tooth in there. So I take out the wax. I take the wax out on both the laterals. I have a question for you. In your fixed class, how have you've prepped teeth, right? All last year, and you've been prepping teeth this year, right? And have you all talked about making provisionals? And you make a provisional by having a vehicle, And with that vehicle, you use some type of polymethylmethacrylate to, and you lubricate the prep, right? You didn't lubricate the vehicle, did you? I don't think you have to. I don't think you should. Some people do. I don't think you have to. And then once you go on and off a couple of times, you have to trim it up and particularly at the gingival area, so it's not bulky. So you all have made temporary. And so if that was a real patient and you did that, what's next? Well, make a final impression, that's right. So in order to make a final impression, y'all made custom trays? No, not yet. But you're probably gonna make custom trays. And if you make a custom tray, then you'll learn how to make an impression for whatever you've done fixed wise. Is that correct? So why are you making an impression? Why are you doing that? To get the final crown. Well, that's true. Get the final crown. All right. To get the final crown. Okay. Well, good. I'm glad that that's what y'all are doing. Yes. Mm-hmm. Yeah. Yeah, anything that I ever try to handle, if I've handled it, I want to put it on, I want to wipe it down with chlorhexidine, before I go in the head, pretty much, most of everything that I do. Lord. Oh, you talking about your denture? Well, you didn't jump ahead with it. You got the canine in there. I ain't even said nothing about the canine. That canine is, you got a special thing. It's a special thing with the canine. If you don't do what I said do, which is out at the neck, it kind of doesn't have the appearance it needs to have. So let me get to that out at the neck piece. Let me get this lateral in here, and then I'll show you what I mean with the canine. The canine's got to be out at the neck. Very important. Out at the neck is a real important thing. So this is the lateral. So all I've done so far is upper lateral, lower central, lower lateral. All right, pretty much this. Where we are, let's straighten it out. Straighten this out. Straighten this out. What does it say for the lateral, for the medial distal inclination? Slightly to the distal at the neck. So it is, and it is. So I'm going to solidify these by heating the wax up. And you go back to the plane, make sure this plane occlusion is good. Just continue this journey. Alright, so I'm gonna solidify these lower anteriors with some hot wax. And don't burn the teeth, but you know, you can put, it'll take a little heat if you don't want to burn them. And I'm gonna ring walls, solidify them. Okay, now I'm going to clean these up so that they look like teeth emerging from the gingiva instead of artificial teeth set on a base plate. They look kind of natural. Now, I'm going to clean up these lowers and around the gingiva, and by the time I set the upper, my upper canines, we'll be ready to leave for the day. And so, we have class next Tuesday. How many more classes do we have in this course? You have a few? All right. So next week, this is where I'm going to pick up the ball after I, pick up the ball right on the canines. All right. So let me place in my upper left and right canine so that you understand what I mean when I say out at the neck. All right. So I'm going to figure out what my width is with my knife, and I'm going to cut a window on my upper so that I have an area where I can place my canine. And I'm going to do both of them. I'm going to do both the right and the left at the same, well, not at the exact same time, but I'm going to make room for the canine on the right and the canine on the left. So I'm going to cut a window. Remove the wax. Cut a window. And I remove the wax. For my upper left central, and I'm going to cut a window and remove the wax on my upper right, for my upper right canine. Number 6. Now, what do I know? So when you remove this wax, you need to remove it as if you understand that it needs to be, the distal portion of the canine needs to be kind of pointing to the distal. It's to the distal at the neck, but it's out at the neck. Well, how going to be out and to the distal? Well, it's going to be out at the neck, and when we look at it from the frontal view, or when we look at it from a sagittal view, it's going to be to the distal. Like, how is that? Well, you know what? You need to remember that teeth have surfaces. You know, it's not like it's a box. It's not like it's a round balloon. We have 5 surfaces: a facial surface, got a proximal, mesial proximal, distal proximal surface, got a lingual surface, got an incisal edge, or occlusal surface. And so you can move these teeth in many, many different ways, and I think that's what you appreciate if you do it on a, like how Dr. Goodacre did it on the computer, how you could turn things, you know, in your mind digitally, maybe but I mean, these are real teeth going in some real heads, so we need to understand this concept. If we can understand this concept here, we can definitely understand it if we have to use a digital maneuvering of it. All right, the canines, maxillary canines. I have removed the wax from my upper canine and from my lower canine. All right, so we're getting ready to get rolling on those. Let me clean up my wax on my mandibulars here. I want to kind of sweeten that up a little bit. Hold on. Clean that up a little. So I'm going to do like I told you. I'm going to go around each tooth from the tooth side. Remember that when I talked about how we want to kind of make it look like actual gingiva? Well, we're going to take the instrument and go around each tooth, approaching the tooth from the tooth side, making a scallop, making sure that we get all of the wax off of the facial surface of each tooth. So we get that removed, coming from the tooth side. Now I'm going to put my scallop around the tooth, coming from the tissue side to make that nice little scallop, sort of a bevel, so that it looks like a natural kind of emergence from the gingiva. And you make sure that we clear all of the wax off of the surface of the tooth. All right, so it is tedious. Wax is tedious, and it's, you know, it just kind of nags you. You get it how you want to get it, but you know, you can be very patient with this. Person in the dental lab who makes more money than anybody, usually in a denture lab, is the setup person. So they earn their money, because this is just think if you just was sitting down at a bench all day doing this. They'll knock out a wax up in 10, 15 minutes, upper and lower wax up. So we've taken about an hour and a half. We've only set up like 4 teeth. But a setup person is able to set them up and grind it in, and you know, so there's a level of skill involved in doing one of these things. But you as the dentist need to have some criteria as to how to criticize this person who's been setting teeth for 25, 30 years, and then all of a sudden you get out of dental school and you're the boss. And so you have to be able to tell them certain things how you want it, or you know, sometimes someone will give you something to do, and you know that's not how it should be. Hold on, Dr. Davis. Yes. Okay, I have to get back with you. Right now I'm in the middle of teaching a class. So I will. Thank you. All right. All right, so I've got upper and lower in there. I've got my canines removed, or the wax where the canines are going to be. I've got that removed, and so now I am preparing to place my canines in. torch it just a hair before we go. So I've got my upper four, my lower four. Now, what have I been talking about this canine? Okay, maxillary canine. Let's get it wet. I'm going to get my wax moist so that I can place my canines, my upper canines in place. And I'm going to give you a tip for next week to pay attention. If you've got your card of wax in front of you, I'm going to give you a tip about these posterior teeth. All right, so I've got that going. I'm going to place in my upper left canine. And I said I wanted it to be out at the neck. Oh, shoot. You know what? I don't have room to have it happen. All right. So that's where next week, that's what's going to happen next week. All right, now I want to put it out at the neck, but guess what? I don't have the room. If you look very carefully, when I remove that wax, you can see how I remove the wax down to the base plate. Can you see that? So I'm going to have my handpiece set up next week, and I'm going to actually remove some of this base plate here.
Oh, wow.
And you see, I'm down to the base plate. Can you see it? All right, I'm going to remove some of the base plate, and I'm going to do a little bit, not a lot, but I'm going to do a little bit of grinding on the inside of this tooth. If you look at how these teeth are made, they've got a little cingulum, and it's very prominent here. And if I take that down a little bit, it's going to give me enough room to place the tooth where I want it to go. So that's what I've got to do on the upper left canine. Let's see what happens on the upper right canine if I have room. I may have room on the right side. Let's see. All right, so I'm going to remove this wax here. And what I'm going to leave for you is I'm going to leave this wax up that was done last year. And you can actually see how the canines sit in the arch. The canines from last year are out at the neck, but that bite on the one that was done last year is different than the bite on the one we did this year. So you can't really put this back on the mannequin the same way. But let's see what happens when we heat up this right side of the canine. Yeah, I'm gonna have to grind on this one. All right, if you could put me on the overhead, I'm gonna show you how it's in there. Okay. All right, so this is an articulation from last year. This is an articulation from last year, and you can see the centrals. All right, you can see the centrals, how they're straight, with a little bit of a distal inclination at the neck of both centrals, with the laterals slightly distal to the neck. And the canine is out at the neck, meaning that this canine is out at the neck and it's kind of tucked in. Can you see that? See how that is a little slightly to the distal, but it's out at the neck, so that the lateral and the central are kind of depressed, but the canine is out at the neck and it's tucked in. Same way on this side, that it's out at the neck and it's tucked in. All right, so I don't have enough room on mine to place it to be able to do that. So I'm going to have my handpiece next week. I'm going to grind on my base plate, and I'm going to grind on the tooth, on the inside part of the tooth, so that it'll fit into the area that I need. Now, I want you to pay attention to this last thing before we leave out of here. If you look at it very carefully, you can see the difference in the posterior teeth. You know, dental anatomy, one of the things that happens a lot of times is that students will put upper teeth on the lower and lower teeth on the upper for the posteriors. Remember that big mesiolingual cusp, okay? On that first molar. Big old mesiolingual cusp. Don't get them, sometimes you can get them mixed up. And I've seen students that have the maxillary first molar on the lower and the lower first molar on the upper, right? And when you look at the lower first molar, you can see that the lower first molar has, as we always, did I press something there? There you go. Probably get one of these things. But know that, you know, we kind of go back to our nursery rhymes. All teeth develop from 4 developmental lobes except first molars, which develop from 5. So you know that the mandibular molar has 5 cusps, 3 facial and 2 lingual. The maxillary has 5 cusps also. They have 2 facial, 2 lingual, and then that little lingual carabelli, rudimentary cusp. But sometimes we can get mixed up and have the upper on the lower and the lower on the upper. You don't want to have that as a place where I can take points off. Okay, so what I'm going to do now is I'm going to call it, because it's almost noon. You all have class this afternoon up here. All right, so this give you a chance to clean up and stuff. So really, it'd be nice if we all started our journey the same place next week. We got an upper and lower centrals set, and we're going to be looking at placing in our canines, and followed by our premolars and molars. All right, I'm done. Thank you so much.